Myth number 1. Coronavirus, COVID-19, is just like the flu or common cold. False. Even though COVID-19 causes flu-like symptoms like fever, cough, and shortness of breath, it is roughly 10 to 30 times more deadly than the seasonal flu. And preliminary estimates show it might be about twice as contagious, which explains why it can spread exponentially through the population. Myth number 2. COVID-19 will definitely disappear by the summer. False. Because COVID-19 is a unique virus with unique properties, the World Health Organization announced that world leaders should not assume that COVID-19 will be seasonal like the flu. Public health experts estimate that we could be dealing with COVID-19 for 6 months or more. Myth number 3. COVID-19 only affects the elderly. False. The COVID-19 virus infects people of all ages. However, evidence to date shows that people over 60 and those with underlying medical conditions are most at risk of developing severe symptoms. Even if a younger person shows mild to no symptoms, they may still be contagious and infect many others around them. Myth number 4. A vaccine will be available soon. False. Public health officials say that it's possible we could have a vaccine for COVID-19 in 12 to 18 months, but most experts agree that that's an extremely optimistic projection. Myth number 5. Saline, garlic, and sesame oil can prevent coronavirus infection. False. Even though some home remedies might help boost general health, there's currently no evidence that these can prevent COVID-19 infection. The best known method of prevention is washing your hands frequently with water and soap and avoiding close physical contact with individuals and large groups. Myth number 6. Swallowing bleach or spraying your body with alcohol or chlorine can kill coronavirus. False. Ingesting these chemicals or applying them to your skin will cause more harm than good. Please don't do it. Myth number 7. The coronavirus is man-made. False. COVID-19 can be directly traced back to bats, and the first few cases can be traced back to a seafood and live animal market in Wuhan, China. Myth number 8. Catching the coronavirus is a death sentence. False. Even though we don't know the full extent of COVID-19 on the global population, what we know so far is that the mortality rate ranges from about 1 to 4% globally. So what can you do to prevent infection of yourself or others? COVID-19 spreads when a person coughs or exhales small droplets from the nose or mouth. Others either breathe in those droplets or, after coming into contact with the droplets that land on different surfaces, the person touches their mouth, nose, or eyes. The World Health Organization recommends keeping a distance of more than 1 meter, 3 feet, from someone who is infected, washing your hands often with water and soap for at least 20 seconds, and avoiding touching your face as much as possible. If you're feeling ill and coughing or sneezing, cover your mouth and nose with your bent elbow or tissue and self-isolate as much as possible. Approximately 20% of cases will be severe to critical and might require hospitalization. Slowing down the rate of infection is the best way to avoid overwhelming our healthcare systems with a sudden spike in severe cases. For more information, visit the World Health Organization website and follow the guidance of your local health officials.